morning. How are you?
I'm fine. You?
Fine. My name is Robbie. I'm your nursing assistant. You need to use the bedpan?
Yes.
All right, let me wash my hands and we'll get started. Okay. She actually has these hand wipes over there on her stand. So I'm gonna go ahead and grab one of those. Get my gloves. All right. I'm gonna go ahead and pull your curtain for privacy.
So now we have to relook at it.
I stopped. Raise your bed up just so I can not hurt my back. I thought I was. Wow. I didn't eat my Wheaties today. I'm gonna have you turn to your side in a minute. I'm gonna put this pad underneath you to protect the bed. Alrighty. Would you turn on your side for me? Perfect. Keep you covered here. I wanna get your gown out of the way. Perfect. You're good. Okay. You doing okay?
Yes.
All right. I'm gonna make sure I get the pad turned with the plastic away from the patient. Okay, good job. You wanna roll towards me? Awesome. Roll the other way. Good. I'm gonna pull this out on the other side. Okay. Go ahead and roll back for me. Good. All right. Should be there. We have a fracture pan, so go ahead and put this one under you. I'm gonna leave my drawer open. This is a fracture pan. So could you just bend your knees? I'll have you just bend your knees. And I'm gonna slide this right underneath you. All right, go ahead and sit back down. How's that feel?
It's good.
Is it good? All right. And go ahead, I'm gonna glove off and I'm gonna raise the head of your bed. Get you to a seated position. And I'm gonna hold the foot of the bed button down as I raise the head of the bed. Because if I don't hold the foot button down, then the feet come up and she'll have her knees in her face. Still doing okay?
It's okay.
All right. Get your call bell for you, wherever it disappeared to. You got it?
Yes.
All right. Okay, I'm gonna step outside and you can just ring when you're done and I'll be back.
Okay.
And she's ringing. Okay, I'm back. Y'all done?
Yeah.
All right. Now, ordinarily, if we were doing this and we were going to, take care of other patients, we would have washed our hands after we took our gloves off. But because she's looking at your technique, and this is a time skill, we're bypassing that, okay? All right, this is a little hand wipe I'll give you so you can open this up and wipe your hands for me. Okay? Now, what did I forget?
You forgot the paper.
I forgot the toilet paper.
Mhm.
Okay? So, I've made a mistake, state examiners. May I correct it?
No.
Yes.
I thought you said no.
No. So I'm gonna correct it, okay? What I would have to do at this point is get her the toilet paper, which would be in the drawer. You won't have to go to another drawer, folks. The toilet paper should have been in that drawer. You didn't see that either. Okay, so I made a mistake and I'm gonna correct it. Here's your toilet paper.
Okay.
Please ring when you're finished and I'll come back and assist you. stepping out. I would've, normally I'd wash my hands. She's finished? Okay.
Hold on, wait, question. How
So-
does she wipe her butt?
The toilet paper.
I mean, I know that part, but
She's already done with it. You don't have
She
to
do it herself?
technically go through it. How would she wipe it? Just like you wipe yours when you're sitting on the toilet. You're sitting up.
Should
So,
I put
and
it
then, you know, if they can't wipe themselves, then we help them once we lay them down, but that's not this, we're not gonna read into the skill, okay? So, she's finished with the toilet paper. I'm gonna go ahead and put that away. We'll pretend with this one. I would open this up and give this to her for her to do her hands. Okay, now I'm gonna lower the bed down because I need to take her off of the bedpan. So you have some paper towels here, so I just grab a paper towel. And I'm gonna lower the head of her bed. And I'll show you how to take the incontinence pad and the bedpan out at the same time. It works really well. Okay, she's gonna bend her legs up, and I'm gonna pull this bedpan out, and I'm gonna roll this pad away from her. Okay, you can put yourself down. And I'm gonna actually lay this on top. And then, it's her sheets, so I can touch her sheets. I'm gonna go in the bathroom. I can actually throw this in the garbage. I'm gonna then rinse this and dump this in the toilet, in the bathroom for real water, okay? And rinse it, okay? I'm gonna pretend this is in there. Then I'm gonna take another paper towel in the bathroom and dry it. And now I'm coming back and I'm gonna put it in the bottom drawer. All right, I'm gonna straighten out your bed linens for you. Can I get you a magazine or anything?
no, I'm all right.
Okay, let's make sure I leave you. I've made a mistake, may I correct it?
Yes.
I've made another mistake. Can I get you to turn on your side for me? I wanna make sure your gown is not all jacked up in the back. See, I moved her down to put her on the bedpan. I don't know if the state would do this, but it's nice brownie points. Remember, my curtain has not been pushed back yet. So I'm gonna make sure that I've got her gown straight and it's not all jacked up. Okay, there you go. Now I can go ahead and fix your bed for you. And you said you didn't need a magazine? Alrighty. She's got her call bell beside her. See, by making mistakes, the clock keeps ticking. Alrighty, we're all set. You don't have to make the bed perfect. Just don't leave it trashed. She's got her call bell there. Taking my gowns off, my gloves off. Alright. I can go ahead and shut the drawer. I've got my dirty gloves off. Shut the drawer. Too many trips around the bed. Push the curtain back. Call if you need anything.
Okay.
Have a good afternoon. So I made two mistakes. Now you won't have to worry about there not being toilet paper in the bottom drawer. She's gonna have that there, as it is, okay? She's gonna have paper towels here. She has the wipes here, just like you see over there. So you're not gonna forget the toilet paper because it's gonna be there. See, it wasn't there for me, and right over my head, but that's how you make a correction. You look at the state person and you say, I've made a mistake, may I correct it? And from that mistake is where you make the correction and you keep going on. If you don't make the correction, then that's when she nails you. They realize you're stressed out, you're nervous, and they realize that, okay? They don't expect perfection.
So you can